Welcome to A to Z Nursing Vlogs. This video is about what a hospital is, its types, and the functions. We all know that a hospital is a healthcare institution providing patient treatment with specialized health science and auxiliary healthcare staff and medical equipments. Let's dive into the video. We need to know a little history about the hospitals. Let's see what the history tells about the hospitals. The history of hospitals began in antiquity with hospitals in Greece, the Roman Empire, and on the Indian subcontinent as well, starting with precursors in the Asclepian temples in the ancient Greece and then the military hospitals in ancient Rome. The Greek temples were dedicated to the sick and infirm, but did not look anything like modern hospitals. The Romans did not have dedicated public hospitals because the public hospitals did not exist until the Christian period. Towards the end of the 4th century, the Second Medical Revolution took place with the founding of the first Christian hospital in the Eastern Byzantine Empire by Basil of Caesarea, and within a few decades, such hospitals had become ubiquitous in Byzantine society. The hospital would undergo development and progress throughout Byzantine, medieval, European and Islamic societies from the 5th to the 15th century. European exploration brought hospitals to colonies in North America, Africa and also Asia. Early Chinese and Japanese hospitals were established by the Western missionaries in the 1800s. In the early modern era, care and healing would transition into a secular affair in the West for many hospitals. During the World War I and World War II, many military hospitals and hospital innovations were created. Isn't that interesting? Now let's see the definition of a hospital. A hospital is an institute for the care, cure and treatment of sick and wounded, for the study of diseases and for the training of the doctors and nurses. What are the classification of a hospital? The hospitals are classified according to the size and bed strength, on the basis of ownership or control, on the basis of their objectives, on the basis of the systems and on the basis of management. On the basis of size, the hospital can be classified into a small size hospital where there are 100 or less number of beds, a medium size hospital where there are 101 to 300 beds, a large size hospital where there are 301 to 1000 beds. According to the bed strength, the hospitals can be classified into a teaching hospital with 500 and above number of beds, a district hospital with 200 to 300 beds, a taluk hospital with 50 to 200 beds, a community health center with 30 to 50 beds, and a primary health care center with 6 to 10 number of beds. On the basis of ownership or control, the hospital can be classified into a government hospital which is run by the state and central government, a non-government hospital, a voluntary hospital, a private nursing home, private hospitals and corporate hospitals. On the basis of objectives, the hospitals can be classified into a teaching cum research hospital, like in the case of a medical college hospital, a general hospital to provide the treatment of common diseases, for example in a PHC or a CHC, a specialized hospital to provide medical and nursing care in specific area, in the case of a cardiac hospital or an ophthalmic hospital, an isolation hospital which keep the patients suffering from communicable diseases, a rural hospital which is located in a rural area. On the basis of systems, the hospitals can be classified into a long-term care hospital or a chronic care hospital. Here the patients with chronic diseases like leprosy, cancer are taken care of. Another classification is a short-term care hospital or an acute care hospital, where the patients stay in a hospital for a short period of time, like in the case of pneumonia. On the basis of management, the hospitals can be classified into hospitals which are run by union government or the central government, hospitals that are run by local bodies, for example Zilla Parisad or Panchayat, autonomous bodies like in the case of AIIMS New Delhi, private hospital, Mahe Manipal, a voluntary hospital in the case of CMC Vellore. What are the functions of a hospital? The hospital takes care of the sick and injured patients, diagnosis and treatment of the disease, prevention of the disease, promotion of health, rehabilitation, vocational training for the medical, nursing and paramedical students, medical and nursing research, outpatient services and also inpatient services. These are the functions of a hospital. Thanks for watching. If you find this video informative, like it, share this video with your friends, and comments are welcome for more improvements, and subscribe the channel for more videos and updates. Please don't forget to click on the bell icon for notifications.